I think as a nurse, you're always looking for what's the next new intervention to help your patients, or what's the next strategy to improve health outcomes. And I think it's just the next step in finding those answers.
A PhD gives you a lot of latitude to use your research skills in both evaluating evidence-based practice as well as directing your own investigation or serving on interdisciplinary teams of researchers. It gives you a lot of flexibility to work at the local, state, and national, and even the international level. You can't go wrong with a PhD.
I've come to see more and more of the opportunities to affect change in people's health that extend beyond sort of the day-to-day things that we do in active hands-on nursing, and try and find solutions to problems or look at things from a bigger perspective.
Certainly in our policy research, we are affecting a large number of people because I've been a public health nurse for a long time, and we've done lots of education in the schools, trying to teach kids about tobacco and secondhand smoke. But it doesn't have the same effect that a policy does.
The work that we do affects whole communities. It goes beyond patient care. It looks at how, if a community passes a policy, for example, can it reduce smoking, for example? Can it make the air clearer? Can it make the work environment better for bar and restaurant workers? And then we've also done research not only looking at the outcomes of our work, but what makes the intervention effective. In other words, what factors lead to, particularly in rural areas, what factors are associated with rural communities taking the step to change policy to make their communities healthier.
My program of research centers on helping moms quit smoking during pregnancy. It's based in maternal child health, and I became very, very interested in smoking cessation during pregnancy when I would round in the hospital, and I would continually see these high-risk moms going outside to smoke. And I'm thinking, you're pregnant and you may deliver early, but you still have this addiction and you need to go outside and smoke, even when you're in the hospital. Through research, I found that there's very few programs and very few interventions that really have been successful helping pregnant moms quit smoking. And so that became my passion of wanting to help. I was really interested in not only smoking during pregnancy, but also secondhand smoke exposure. And what we found is that moms that did not smoke during pregnancy, but were exposed to secondhand smoke in their home, their infants were as equally likely to be admitted to the NICU and equally likely to have respiratory distress problems as the smoking moms. So I think that was really one of the first studies that really looked at non-smoking moms' secondhand smoke exposure and how that can affect pregnancy.
There are a variety of students that work with the tobacco policy group, and they have the opportunity to participate in a lot of different aspects of the research, who help with actually collecting the data, who help with writing. There are a lot of students who participate in scientific conferences where they go and present data, they present posters, sometimes papers. Just pretty much the whole gamut of the research process, students are involved.
As part of a randomized community trial, I deliver the intervention for 6 rural communities, and so I've had the opportunity to work with them through multiple stages of smoke-free policy implementation. So some of our communities in earlier phases, we help them with secondhand smoke education in the community, or just disseminating science. We help them with, as they move further along with, for example, air quality press conferences, and we help them all the way through to the legislative phase. So it's been a challenging and also rewarding project.
The PhD program here is very strong. It has a very solid core of courses that really make you feel prepared for the work that you're going to do. I've completed my coursework now, and I'm a candidate. I'm working on completing my data collection. But I feel like I was very well prepared in terms of just the nuts and bolts of what I needed to do, plus this exposure to other areas.
The opportunities that, for example, our team or the Rich Hart team give to students to participate, there's really no limit to it. It's only limited by what they want to do, and they will have help every step of the way. To watch the PhD in nursing student that's worked with us over the past couple of years, it's just been fantastic.
I love student involvement. To me, it's the epitome of doing research in an academic institution. The University of Kentucky really prides itself in student-involved research. We are a land-grant institution. We are right on our way to being one of the top 20 research institutions, and part of that is engaging students with faculty, and we have a really strong team of faculty, and so students who come here really work right alongside faculty who are successful at publishing and getting grants and doing the kind of work that nurses need to do to be cutting edge. And so, yes, the University of Kentucky is a great place to be for that reason.
I have been happy with the choice to come here at UK. I feel like the faculty are all really great here, and it's just a really supportive atmosphere here at UK.
I was kind of unique in the fact that when I started the program, I wasn't quite sure where I was going to end up. I didn't know if it was going to be strictly research, a combination of research and education, a combination of research, education, and clinical practice. I think the value of having a PhD can help you in each one of those areas.
The bottom line with my research is I really just want to do everything I can to prevent disease. Instead of focusing on treating it, let's try to figure out innovative ways to preventing people from getting sick, and that'll reduce the burden not only of disease, but it'll reduce the economic burden to society. It's an exciting endeavor. If you're somebody who wants to always be growing and changing and learning, research is for you.